Welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. Doing something a little bit different today. We're actually going to do the Medspa Minute. We get so many questions, we thought we'd bring our expert in today, Andrea, who you're going to meet shortly. And she's going to basically cover a bunch of topics and questions that we get all the time. Before we get to that, let's go around the room, check in with everybody. We'll start with you, Dr. Arredondo. Tell us a little bit about what's going on in your life.
Well, we did one other fantastic vacation this summer. We spent about 10 days in the Yellowstone area.
Oh, damn. Okay.
Yep. And my daughter showed that she is an awesome fisherwoman. She caught, what was it? 4 rainbow trout in under an hour on day 1. And then day 3, another 4.
Damn.
So she's feeding the family on these trips.
Yeah.
That's fantastic.
Because I've caught about 4 fish in my life, I think.
Yeah.
Dr. McAuliffe, what about you?
Not too much. Just hanging out here in Austin for the weekend and just relaxing. That's about it. Got those boards submitted to the American Board of Plastic Surgery just yesterday.
And this is something that I think people don't realize, to be board certified plastic surgeons, it's a process. People are going to be several years out, and this is one of the things that's super unique and challenging for us, but great for patients, is that, for someone to be a part of this elite group, they've jumped a lot of hurdles.
That's right.
Made a lot of accomplishments. So congratulations.
Thank you.
Dr. Weinfeld?
Well, I'm really excited. I'm starting to plow through a lot of my pre- and post-operative photographs with Ashley in the office, Nurse Ashley, in order to get them up on all of the channels that we have to be able to distribute them or show patients what we're able to do. So that's been a lot of fun to work with her on that.
So you're welcome to all the patients who get to see all this work.
Yeah, and thank you to Ashley because she's been a really immense help.
That's great. And then our special guest, Andrea, a new esthetician in our San Antonio office, came all the way to Austin to share her knowledge with all of you. You're new to Austin Plastic Surgeon, but not new to the world of aesthetics.
Exactly. So I've been doing this for about 5 years, and I've been laser certified for 3.
You look way too young to have been doing this for 5 years.
I know. How old do you think I look?
Oh, I can't answer that question. She tried to bait me right off the bat, and here she's been sandbagging us. She said she was nervous, and she's already like, shots fired.
The bait has been set.
Well, tell us a little bit. What did you do with your other practices, just so people know where all your knowledge and expertise comes from?
Yeah, so I've done a little bit of everything. So microneedling, radiofrequency, MD pen. I've done a lot of lasers, non-ablative, ablative, laser hair removal, IPL, Hydrafacial. So I've done pretty much a lot of it.
So let's jump into it, because we get a lot of questions, and one of the most common questions we get, and I know this is a specialty and near and dear to your heart, so that's why we stole your valuable time today and appreciate it, is the difference between Skinpen and like a Vivace or Morpheus 8, which are, the Vivace and Morpheus 8 are radiofrequency microneedling, but there's the traditional Skinpen, and from the more I've talked to you, there's places for both of these. And maybe tell us the differences and where we would pick one versus the others. We got a lot of facial specialists in the world too, so I apologize when they start peppering you with questions.
I know. Okay, so typically,
so
yes, no, of course, I promise. So a lot of the questions I get asked when I see a lot of my patients is, when should I do my bigger procedures? So a lot of my patients in their 20s and 30s, like, well, I want to do microneedling radiofrequency, but a lot of the times I say you can get away with the Skinpen because you're not really losing that elasticity. So we want to stimulate that collagen, wake it up. And then I have my other patients that are like in their late 50s, 60s, and, they're like, well, I want to get Skinpen. I heard it's great. It stimulates collagen. But they have that little bit of, saggy skin. So that's where the Vivace or the Morpheus comes into play, with that radio frequency that heats the skin and heats that tissue. So they're essentially the same thing, but different. And I mean, they can cater to all skin types, but, if you want to get a little bit of that skin tightening, that's where, the radio frequency and microneedling comes from.
How about from a downtime perspective? Is there a downtime difference between Skinpen and one of the RF microneedlings? Because that's a huge question that patients ask us, because a lot of times somebody will, that's another question. I take this one question.
Yeah. So it's different. I feel like the older you are, your healing time isn't as quick as if you were younger. And I think if you're on blood thinners... You shouldn't talk about Dr. Arredondo that way. He's a lot younger than he looks. I think, especially if you're like on blood thinners as well, I think, with the bleeding and the microneedling and things like that, it can probably prolong your healing process as well. Mm-hmm.
How do you work with the three of them sitting across from the from us, do a lot of facelift, facial rejuvenation. How do you work with them? And maybe I'd love to get your guys' input. When do you want them to do some skin resurfacing? Because I've always in my mind thought that like, hey, nobody comes in and says, I was in my convertible going 100 miles an hour. My skin was so taut. So we can only pull people so tight, and that won't get rid of some of the fine lines and wrinkles. And I think that's what you use the Skinpen RF microneedling for. How should you do timing of this? And I'd love to hear from all four of you. Do you like to pre-treat some people? Do you like to do the face and neck lift first? And then how long do you make them wait before doing some of this? How should people approach this overall?
Yeah.
Well, Dr. Warren, what do you like?
This field and the marriage between non-invasive and invasive facial rejuvenation really has accelerated. So I don't pretend to have the absolute answer to this, but conceptually and in my experience, what has made sense is to do the facelift, the neck lift, and then to come back and do the non-invasive procedures subsequent to that. It's that kind of analogy of, I don't know, I've never built a drum, but when you build a drum, you've got like the barrel. The barrel, that supports the drum, and then you put the skin over it. And so that would be the process of doing the facelift. And then what you do is you wet that skin and help shrink it. Whereas you wouldn't want to shrink the skin and then try to pull it, tighter over that drum that you're building. So another analogy, you build the house and then you paint it. All of these kind of work well. So I think that it makes sense to kind of to do that facelift, the neck lift, and then really to polish things off with all the wonderful options that you have available. But if someone were to say, no, it makes more sense to do it another way, I'm not opposed to that in any way whatsoever.
And that's the category of people that need a face and neck lift up, because there's some younger patients that maybe we just didn't take care of our skin as well as we should have growing up.
Are you looking at me?
Well, I'll tell you,
He's judging.
When I grew up, we used to get our first good sunburn at the beginning of the summer. That was it, and we thought that was a good idea, because then you were like set. You got your a couple days of peeling, and now we realize how horrible of an idea that was, for our skin. And so there's some people that may not have the skin laxative to need MyElevate, a face or neck lift, but they have a little skin tightening they want, or some just texture stuff they want to do. Is that correct?
Yeah, correct. So I've worked.
So you want to steal patients from Dr. Weinfeld and Dr.
Yes,
Micallef?
exactly.
Okay. Oh, go ahead.
Would you say, after a patient who gets a facelift, would it be better to maintain their results with these type of treatments from me?
Absolutely.
Yeah.
So much so it's almost a rhetorical question.
Yeah.
Definitely.
Okay.
Yeah.
I feel like she set us up.
Yeah.
She did.
Because you wouldn't buy a Ferrari and never take it for an oil change. Like, it just doesn't make any sense. And we've talked about on previous episodes, we're turning back, resetting the clock. But if you don't do these things to take care of it, and I know I'm preaching to the choir, but sunscreen, good moisturizer, maybe you can hit up some of those. And then you've spent all this money. I mean, I guess it's fine for us. You're going to be back in a couple of years, but it's not really protecting your investment.
Right. Yeah. Like you said on a previous episode, you don't just want to turn back the clock. You want to slow it down. Yeah. And that really helps slow it down.
Yeah, it keeps it slow. Absolutely.
From your perspective as our esthetician, how often would you say that patients should be getting radiofrequency microneedling or microneedling?
Yeah.
And also the same question for exfoliation-based procedures.
Yeah, that's a great question. So if you have a specific goal, say you've never had any type of procedure done to the skin, filler, Botox, and you come in and you have a lot of elasticity, it's going to take a few treatments on a monthly basis along with a good regimen. But if you were someone who is wanting to pre-treat, I would say quarterly. Do your big treatments quarterly, and then your facials in between to maintain the skin.
Okay.
Let's say we have a good-looking, middle-aged plastic surgeon that just wants to freshen up some of this.
Thank you very much.
What would a true regimen look like in terms of from number of skin pin treatments? And I know it varies on their skin, but like on average. And then what other things would you put them on? We alluded to sunscreen, moisturizer. What would you tell all these middle-aged mature men in the room that are interrogating you for personal gain here?
Yes. So I would say 3 treatments off the back monthly, and then use a really good retinol at night, vitamin C, sunscreen, of course, moisturize the skin. And then after your 3 treatments consecutively, then I guess try to do it quarterly. If that makes sense.
Do you recommend exfoliation
Oh, exfoliation.
Mhm.
Yes, definitely. So you can get exfoliation different types of way. You could do it chemically, you can do it manually. So whether you're doing dermaplaning or using like a scrub or things like retinol. So you can
Mhm.
get your exfoliation either way. I don't know if anyone's ever mentioned this, but as we get older, our skin cells, they don't turn over as fast. So when you're younger or a baby, every other day it turns over. And as we get older, it's like every 20 days, 30 days, 40 days. So that's where, exfoliation comes in. Yeah.
Mhm.
So I just want to summarize microneedling. So because we have a lot of questions we want to pepper you with
Yes.
today, and so
Mhm.
basically it's the two. So you have Skinpen if somebody doesn't need any skin tightening. If they have a little bit more skin laxity we want to
Yes.
treat, then you would suggest doing the RF microneedling, which would be either Vivace or Morpheus
Yes.
8. If they were
Mhm.
going to get a face or neck lift, save this, do it after the surgery. Would you guys say, are you comfortable with about 6 weeks after the face and neck lift?
Oh, I would say that'd be just
Yeah,
fine.
I
Yeah.
think
yeah,
6
yeah.
weeks with no healing issues,
Yeah.
no problem.
Okay.
Yeah.
Yeah, I've
And-
even considered
yeah.
doing it like at the end of a face or neck lift.
Yeah.
I know there's some people out there will do Morpheus 8 or Vivace immediately after.
Yeah, I think that's a good point. I mean, one of my mentors used to do light CO2 ablative
Mhm.
lasering
Yeah,
with
mhm.
facelifts
Yeah,
with
exactly.
no
Yeah.
issues too. So
Yeah.
I think that's certainly possible.
One of the stuff I would love for us to start exploring, as we've tried to get more into this minimally invasive, imagine doing a little bit of cheek fillers, maybe a buccal fat pad, my Elevate, and then a little RF microneedling, for some of those people that you had talked to on a previous episode that just have a little bit of jowls, a little something. I mean, there's a lot of goodness that can happen there with no real exposed sutures, cuts type things.
Yeah.
And
Yeah.
that's exciting in this world of
Yeah.
technology that we
Right.
can get to.
Yeah.
When
And
you
I
start
think-
adding all those procedures, it's more than just the small procedure.
Yeah.
Yeah.
You know?
Yeah.
And this is where it's nice to be able to work in a team where we have, a facelift expert, a Morpheus expert, and so forth, because, we talked about it like with Travis, if it's just a hammer, that's all you get. So if you go somewhere and all they have is Vivace, then that's all you're going to get. If you only have someone that does face and neck lifts, that's all you're going to get. Where there's lots of times that we turn people down and they come in for lipo in my case, and I'll be like, hey, look, I can lipo you, but you're going to spend a ton of money. You're going to see very little difference. If you have some tiny little spot that bothers you, let's do some Eon. Let's do something else. Maybe some M Sculpt. It's just not even worth it for you. And I feel like coming to a place where you have all the options, I think that's one of the benefits. One of the reasons I love having all of you here.
Yeah.
Thank
Absolutely.
you.
Any other key take-home points about microneedling that I missed or you want people to remember? Because if not, I'll pepper you with some more questions.
I don't think so. I love that you can add PRP to microneedling, so
Mhm.
that's fun.
Mhm.
Vitamin C, hyaluronic acid. There's really many different, combinations that you can make. And aqua gold. I know it's a little different. It's micro channeling,
Ooh,
but
Oh, can you
I
can
can-
you tell us a little bit more about that?
yeah. So a little bit of aqua gold from my knowledge so far is it's a cocktail pretty much. It doesn't go as deep as your traditional microneedling. It's really at the superficial layer, but the concept of adding filler for hydration, Botox to minimize the pore size, and vitamin C, PRP, you can add so many different things, just to hydrate the skin and really help with the barrier function of it.
And Aqua Gold is great for, because I've seen you guys
Yeah.
most commonly use it around the eyes, and that's an area that
Yes.
drives people
Oh,
crazy,
yeah.
and that has been really, really nice, and that's an area that the skin is so thin that you really don't need as much deep penetration.
Yes, exactly. It's not going as deep as microneedling where we have to kind of fix the settings on that. And on the aqua gold, it's just very minimal.
So it's basically
Mhm.
like a little fine touch.
Yes, exactly.
It's called fine touch.
Yeah.
Yeah.
Oh, yeah, it is. Sorry. Sorry.
Let's move on to one of my
Okay.
other favorites, if you don't mind.
Yeah.
There's something called hydrogelly masks, and
Yes.
I absolutely love these. One, like it's just like a moment of zen. It was first initially designed for the face, but I know you guys do it in a bunch of other intimate areas, including like the pubic area, but also,
Yes.
and my favorite is for the buttock, because it's nice after these BBL procedures, to kind of rehydrate, freshen this up. It's still bikini season where it's 100 degrees,
Yes.
so you can really, icing on the
Yeah.
cake and do something for this. So talk to me a little bit about hydrogelly masks, because
Yeah.
people see it on the gram, but I don't know that most people realize the benefits, what it does, and maybe how cost effective this is.
So hydrogellies are so fun. There's so many that you can pick from discoloration, hydration, acne. What I find a lot in I guess, the skin world is KP. So a lot of people do suffer from that, and that's where the hydrogelly comes into play on the
For
buttock
those of us that
region.
don't have the skin knowledge that you do, KP is...
Yes, keratosis pilaris. So it's little pimples that a lot of
Oh,
people
I got that.
commonly get. Okay, you're fine. I brought hydrogelly today.
I think it's time for a hydrogel.
I know. So there's exfoliating ingredients in there that can help smooth that area down. So that's what I really like, and it helps with discoloration. Like I said, so they're very customizable, and you can add them to Hydrafacial, or I don't know, just come in and say, hey, I want a hydrogelly.
And how long does a procedure like that take? Is there a downtime? What would I expect? I mean, is this something that Dr. Weinfeld's got a little long lunch break? If he only has 30 minutes, can he do this, or what's going on?
Yeah, so you can come and get it on your lunchtime. I think it's like a $20 add-on, so it's very affordable. And the downtime, none. You're just gonna look amazing after.
I want to look amazing.
I know.
I need this. and so I know we alluded. List off the places that you can get a hydrogelly mask, like where. I know both Austin and San Antonio, but on your body, where could you get it?
Yeah, so you can get it on the face, the buttock region, I'm assuming the thighs, the arms, pretty much anywhere.
Really kind of anywhere you want to treat that you're having some issues, want a little refresh.
Yes, exactly.
Okay, cool. Awesome. Any other hydrogelly nuggets you would like to share with us?
I don't know. I think that's it.
Okay. What topic would you like to talk about next with all the questions you get?
I would.
Well, you're excited.
Sorry.
Go ahead. No, go. You're excited.
Talking over you. Eon. I think it is such a cool device. I've worked with many different body contouring devices, not cool sculpting, but I've worked with True Sculpt, which is radio frequency. I've worked with Sculpture, which is another laser. I really love Eon because it's touchless. You don't have to worry about arcing, burns. It's great for all skin types. So, I'm really excited to work with that device.
How would Dr. Arredondo talk to me a little bit, because one of these things, it's always hard for patients. We all love 20 minutes, no downtime. But how do we get to who's a good lipo tummy tuck Eon? And this is where, and Dr. Micallef, I know that you guys actually saw a patient recently together with Andrea and Gilbert, and she came in for Eon. And then you guys decided, hey, this isn't the right course pass. So maybe the two guys can jump in a little bit. And this is one of the benefits where we don't want you to just do something that's not right for you.
That's right.
I mean, in my head, I always look at the volume that someone's trying to achieve in reduction. I think that's sort of the starting point. And then taking even further, like if there's excess skin, I think you're trying to get skin retraction. I think that's another point.
I think skin is a huge one. That's a great point that people forget about. Because Eon it's fabulous, but it does not, have a tremendous skin tightening degree of treatment.
Right.
Yes.
Yeah, very similarly, I would say that, you need to obviously have a lengthy discussion about what the patient's expectations and or desired goals are, number one. And number two, it really comes down to how much skin laxity do they have? Because if skin laxity is present, Eon is really probably not for you. And so those are really the big factors. Also, truly, how much adiposity are we talking about? Because Eon does show a 21 to 25% reduction, but if somebody has a great deal of adiposity or a great deal of fat in their belly, subcutaneous fat, not visceral fat, then also not going to be
right. You're looking at different procedures.
Appropriate candidate without doing something more on the invasive side.
And I think maybe just tell people what to expect with Eon, because it's unlike a tummy tuck where we're cutting off. And even a tummy tuck, most people don't realize tummy tuck flap is only about 5 pounds at most. So people think that's going to be this massive weight change, which is not true. Eon's going to be even less. But how long or what should people expect in terms of time frame to see a result?
Yeah, so typically about 12 weeks. It's recommended 2 treatments every 6 weeks. And the procedure, it's really fast. It's only 20 minutes. It's very tolerable from what I've seen. So you might feel little hot pockets, but for the most part, it's pretty easy.
Now, just to clarify, I do want to mention that it's 20 minutes per area treated.
Yes.
So if we're treating multiple areas, then it's an additional 20 minutes for each area that's actually being targeted.
Yes, correct.
Can I let you guys on, and you may already know this, a couple little nuggets about Eon. One, the really interesting, cool part is the jet cooling that was actually designed at
NASA.
Yeah, so this is pretty cool.
Yeah.
Because you have NASA technology doing this, and it's actually the same robotic arm that the Da Vinci uses
Yeah.
for all of the surgery. So it just shows you the degree of precision of maybe for your jaw surgery. May bring back some nightmares. So sorry.
More robotic surgery into the world of plastic surgery, right?
No.
The other exciting news, and I don't know, probably going to get in trouble for saying this, but we have actually been working with Eon to create their first center of excellence, where we're actually going to train providers from around the country on how to use Eon, how to treat people appropriately. So Andrea is going to be one of our trainers here in the near future. We're working on setting up these protocols to make this time worthwhile for everyone. So thank you for doing that. Super excited about that. So any last Eon stuff? Because I think we got a couple more little nuggets you're going to share.
No, I think that's it for Eon.
Can we cover Hydrafacial? Because I love this. Because I think people
Yeah.
want to. I love well, I do for myself, but Andrea and Christine are always too busy. I put myself on the schedule, and then it's like I get the notification you've been canceled, and so they're like, sorry, I needed that appointment. Better luck next time. And then I see Dr. Weinfeld walking into the room, and I'm like, holy shit, I got bumped. But what's different about a Hydrafacial versus like the Groupon, blast that we all get, and I see you kind of cringing right now in your seat. Yes. Your toes are probably curling right now. Yeah. Compared to your Groupon $30 facial versus a Hydrafacial, can you tell us the difference a little bit?
Yeah. So I don't know. You just really don't know what type of products you're getting. If you were to get a Groupon Hydrafacial, I feel like a lot of gimmick names like Hydrofacial kind of trick you because some people might not really know the actual Hydrafacial term. It's very different. I've worked with a replica and it was not, you didn't get the glow that Hydrafacial would get.
And correct me if I'm wrong, but Hydrafacial itself has this vortex of fluid. So the Hydrafacial name comes because it's this water, basically mechanical dermabrasion. So the idea is you have this vortex that's basically dermabrasion. Because you talked about this earlier, where you're trying to get this skin to turn over. You're trying to clean out the pores. Some of us, I have really, really oily skin, which is why I keep trying to get on the schedule. But if you can't get this film, can't get that off, then that's when it sets you up to other problems and acne and so forth because those pores start to get clogged. So the idea is that it's not just a fluff where you're rubbing on somebody's face, putting a hot towel in and being like, boom, 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 great, listen to some soft music. That's cool, but that's not the medical grade facial that you guys are performing.
Yes, exactly. And I like to tell my patients, you can spend so much money on skincare, but if you don't renew that skin cell turnover, it's just sitting on there. It's not doing anything. So you can have the best skincare and you're like, I'm not that excited about it. But once you get that Hydrafacial and use that in conjunction with that, just get amazing results.
Can we also talk a little bit, you hit it, skincare product? I'll just tell you guys, my mom, any department store, even though she does this at the office too, she'll come in, you guys will recommend stuff. She'll get what you guys recommend. She'll also walk by the cabinet, grab a bunch of random stuff that she just thinks looks cool. We'll be at Nordstrom's later that day. She'll feel the need to get more stuff. But people can spend endless amount of money on stuff that's slightly cheaper, but on their bathroom table cabinet, they have like 80 products that are half used. They haven't saved any money. They're not buying medical grade products. Obviously this is a pet peeve of mine, but tell us your thoughts as the skincare expert.
Yes. So typically I love to have the conversation with my patients. I like to get started as, what do you use at home? And I kind of call it like a skincare pyramid. So you have your over the counters, I guess your prestige, which is like Ulta, Sephora, and then your medical grade. A lot of people I find that use over-the-counter stuff, they always are like, I saw it on TikTok, or a celebrity like Kim Kardashian or J-Lo. They have their skincare lines and they have amazing skin. It must be great. But what I like to educate my patients on is, the active ingredient is not as potent as something you'd find at a doctor's office. And there's a lot of preservatives and additives in those skincare products versus us. There's really none. So you're getting for what you pay for, essentially with, doctor's office.
And the other part that I think you left out because you're too modest is they're getting you, right? So somebody to help guide them, because most people don't know what they need. They know they need to do something, but they're not sure where to go, which cleanser is best for them, which moisturizer, because what might be best for Dr. Weinfeld may not be what's best for Dr. Arredondo. And this is we're talking to him about, is your skin too dry? Is it too oily? What kind of problems do you have? And I think that's the part that people miss.
Yes. And that's the question I always ask, before we get started. I'm like, what is your skincare concern? and they'll, address it to me and like, okay, well, let's get started with this and let's make a skincare plan with your skincare products and treatments moving forward.
And your schedule. Not everybody can devote,
Yes.
the same amount of time to their morning routines or their daily routines. So that's where you come in and you can say, these are the core of what we need to do every day.
Yes.
And when you go to like a department store, you don't know who you're going to see there this day. Like, I mean, so you do something, they'll come back and see you a month, 2 months later. So you're following their skin progression because there may be some specific issues you're treating. You're like, okay, we're at the right spot now. Now we need to do this. Or, hey, now your skin's drying out a little bit. Let's cut back on this. Let's do that. And so it's basically like you're their personal trainer for their skin, right?
Exactly.
And so, hey, as stuff evolves, we need to keep changing. As the weather changes, we need to keep changing. As we have 105 and no rain, we got to keep changing.
Yeah.
So it's you're their partner in this.
Yeah, I am. I like to believe that.
So you're where if Nordstrom's Macy's their Tinder date, you're more like Silver Lining or like Hinge.
Yeah. Oh yeah. I don't know what that is. I mean, I kind of know what that is, but I don't.
Which one? Tinder?
Oh yes.
Oh, you do know what that is.
Yes,
Okay.
I do. I
Okay.
just don't get on them.
Okay, because you're not like that.
No.
No, you're more like Hinge. Long
I
term.
don't know.
Long term.
Yes.
Okay,
Yeah.
yeah.
You're right. Sorry. I don't know any of that. They were talking about it at work, and I'm like, oh, okay.
What other med spa treatments would you like
I think
to-
we might be able to answer the question about how old she is now.
Well, yeah.
Oh my God, how old do you think I
She didn't
am?
know what Hinge is or Tinder.
Don't worry, we'll connect you with Gilbert. He'll enlighten you on all the different apps and the plus and minuses.
Yeah, I'm sure.
We'll have him do a flow diagram.
Yeah, please teach me his ways. No I'm kidding.
What other med spa treatment would you like to share with people?
Dermaplaning. I
Ooh,
love
that's a good one.
dermaplaning. It's so satisfying for me.
Here's a fact. Well, you tell me, fact or fiction. I've heard a lot of people don't want to do dermaplaning because if they shave that hair, that it's going to come back thicker, harder, darker.
No, that's not true. But I will say I've come across like 2 people in my whole like esthetician career that said that, but I don't know. I don't think that's true.
Okay.
It's an old
Yeah.
wives' tale sort of
Yeah.
thing.
One of those
Wives'
wives' tales
tale.
that we all grew up with.
What does dermaplaning do?
So pretty much we use a surgical scalpel and we exfoliate the skin at a superficial level, obviously. So it takes off vellus hairs, dead skin. So pretty much that's what it is. I feel like it really enhances the Hydrafacial. I've had a Hydrafacial without it. And then when I added it with it, oh my gosh, it was like a game changer.
It's amazing how much comes off
Yes.
just from one session of that.
Yes.
Do you do it
exactly.
before or after?
Before.
Before the
Mhm.
Hydrafacial. Cool.
Before the Hydrafacial. And there's also oil planing, which I introduced to Christine.
Ooh, I don't know about this.
Yeah,
Yes. Yeah. Okay. Do you want
Okay.
to write it down?
Oh yeah.
No, I'm kidding. I'm kidding. I'm kidding. No.
Somebody came in hot today, but I am
No,
gonna
I'm
get
just kidding.
I'm gonna get a little video
I'm
of you.
kidding.
Okay, no
Okay.
pressure. Go. Oil planing.
Okay, oil planing. So it is for more mature, drier skin.
Oh wait, no wonder she said you want to write this down.
No. So I feel like sometimes you can get like a little pull. So the oil is going to help really give you a nice glide on the skin and help it hydrate at the same time.
Oh, so it's kind of a combination treatment, if you will.
Yeah. pretty
Okay.
much.
So, and what oil do you use?
There's one on a website called Dermaplane Pro for estheticians. So I think it has hydrating properties in it, but I don't think you can use just any oil.
So you shouldn't be using avocado oil. Or
No.
Yeah,
I was just gonna ask
no.
about avocado
No.
oil.
Yeah.
I would
Yeah.
assume like
No
the
duck
maybe
fat.
molecules are too big that it'll clog the pores or something like that. So I know the one that I have is non-comedogenic, so it won't clog the pores as
Okay.
opposed to the other.
What about peels? Like, so now that we're getting towards the end of summer, I think peel season's coming back. And so
Yes.
talk to me about that, because people, especially with this heat, tend to have some sunspots, some other things. Peels are different than lasers. Where do peels come in on? Because I feel like that's a thing that
Yes.
people like to say, don't
Mhm.
necessarily know what they do.
Yeah, so really,
You seem excited.
I know. I love peels.
Okay.
Like I do them on myself all the time. It does help with pigmentation. I feel like more melasma than sun damage.
Okay.
Why do you think so? Okay.
Yeah, I mean, it can help with sun damage, but I feel like a lot of, my melasma patients I have to turn to for peels because you can't really do much. But
I think that's a great spot, because a
yeah.
lot of people
Yeah.
want to treat melasma with lasers, other things, and that can actually
Mhm.
make
Make it
them
worse.
worse.
Yeah.
yes,
Yeah.
it's a specific wavelength. There's, I think, one wavelength out on the market that helps with melasma. So it's really important when you're seeing a laser technician is knowing that they know that, because easily you can think, oh, I can just IPL that. one that'll burn their skin off. So you don't want to do that.
Yeah, we don't want that.
No,
Yeah.
So what kind of peels can
back
you
to
do
peels.
for melasma and those type of things?
We have Melanage in the office.
Which I love.
Really, it's a really deep peel. Some downtime. You'll have a mask on for like 12 hours. So Halloween's coming up, so it's like perfect. If someone wants to go get one and be like, "This is my mask for Halloween," just walk around like that for 8 hours. But
what kind of downtime? Are you talking about just being red for a couple days, or what would you say?
Yes. So you're gonna have a white face for 8 to 12 hours, and then after that, you're gonna be red, pinkish for a few days, and then the peeling process honestly really starts on day 3 or 4. So a lot of people will be like, "Oh, I'm gonna plan my peel like on a Friday." I'm like, "No, you're gonna start peeling like that Monday or Tuesday." So you'll look normal for the first 2 to 3 days.
Okay.
And then, so I'd plan it like on a Wednesday. That way that weekend you're peeling. But typically peeling takes about 7 days total. So probably 2 weeks with your deeper peels. You have, your light, medium, and, higher grade peels. So it's different.
And peels are for different things. So this is where you help guide them. Melasma is probably one of the most common and one of the things that's hardest to treat.
Yeah.
But tell me and correct me if I'm wrong, but with melasma, even if you treat it with the peel, this is where you got to get on a good post regimen because just like with the face and neck lift, if you don't take care of it, you're going to be back to see us again.
Yes, exactly. You want to suppress those melanocytes. We have a great cream in office for that, the Boom Boom Brightening. And then good sunscreen. A lot of people think SPF 100 is like the best thing, and it's not that. It's, titanium or zinc oxide that you really want to find in your sunscreen that's really going to protect that skin. So, you don't, when the sun is exposed to your skin, it wakes up those cells that create pigments. So you want to kind of suppress them.
Other questions you guys have for Andrea about some skincare, some of the Medspa treatments?
I'm doing free consults right now. You don't have to pay $50.
I'll be seeing you shortly for my skincare regimen.
Okay, got it.
What are if you had to have 3 take-home points for people about skincare, about this type of stuff? What would be the 3 take-homes?
I would say invest in yourself. I like to say I only do 20% of the work. You do the 80%.
You only do 20% of the work?
Yeah, I do. You do 80.
Wow.
Yeah. Yeah. I do. So, because maintaining at home, it's super important. And I guess the third thing, it's, have a good sunscreen.
And it's funny because people don't realize some of the stuff that's the most inexpensive, like a good sunscreen, good moisturizer, cleanser stuff, makes such a huge difference. And, people will spend all this money on other treatments and won't do the basics. And that's never made sense to me, And so...
Just stick to the basics.
Because if you go and you get one of these peels and then don't even do a sunscreen afterwards, like, again, you've wasted this effort, and Andrea, will probably happy to see you. She'll probably give you the look of like disappointment, the mom or dad shake of like,
Yes, exactly. I'm gonna say put that LaCroix back in the fridge.
Like
come see me in my room. No, kidding.
It's like detailing your car and then driving it through a farm.
Exactly. Taking every dirt road.
Yeah.
Well, I think these are some really, really good points, and maybe we'll be able to follow up with some of these. If you guys want to DM us some more questions, maybe we can steal you here in the near future and do some more of these Medspa Minute stuff, because I think this is super helpful. I think a lot of people want to do some small, subtle stuff. The nice thing about most of the things you've talked about are things that people can be right back to work the same day or the next day, and I think with the craziness of the world now, that's super appealing to people, and small differences early in life make a big difference over time.
Yes, I agree.
Any closing notes you want to?
No, just come see me. My books are open, and I'm super excited to treat everyone. And if you're new to this, I am super excited to help educate you and take you through this path of skincare.
And we see her, please educate her about your favorite app. So
please.
Well, Andrea, thanks for coming all the way up and seeing us. Greatly appreciate this. This has been fabulous. And thank you to all of you for listening. Plastic Surgery Untold, greatest podcast on earth, as voted by us. Oh, before I close, what's your Instagram handle so people can follow you? Because you drop all sorts of fun TikToks and other stuff.
Yes, so it's _aesthetically_Andrea.
We'll type it out for you guys. Don't you worry.
Please.
We'll make this easy. Don't forget to follow us on iTunes, Pandora, Spotify, iHeart, and if you want to see our pretty faces from all the skincare, we've done 80% of the work. Follow us on YouTube as well. We'll see you guys. Bye.
Bye.